Ugh, you can feel it. The pulsing in your temples, the twinge behind your eyes. You don't feel like you have any other choice but to go ahead and reach for a pill. Good afternoon. My name is Rachel, and I'm going to talk to you about aspirin. I'm going to be covering what aspirin is, what the uses are in our bodies, and what the side effects are. The ancient Greeks and Native Americans found that chewing on willow and poplar bark created the same sort of benefits that we see today. The Native Americans also decided to boil the bark in order to make tea for anti-inflammatory purposes for their patients. Merriam-Webster defines aspirin as a white crystalline derivative of salicylic acid used for pain relief and for fever. The Europeans isolated the acid but found it caused severe stomach pain. So Hoffman in 1898 synthesized the acid to make acetylsalicylic acid. The Bayer company then took Hoffman's drug and named it aspirin. Did you know 10,000 tons of aspirin are consumed every year? Now that you know a little bit about the history and the background of aspirin, what does it do in our bodies? It's an analgesic, which blocks the chemicals that create pain in our body. It doesn't do this by making the person unconscious, which was one of the benefits of it. It's only meant to be used for people who have mild to moderate pain in order to be effective. It's also an antipyretic, which reduces fever. It doesn't actually lower the temperature of the person who takes the drug. It just changes how heat is lost through the body. If you take the drug and you don't have a fever, it has no effect on your body whatsoever as far as fevers are concerned. It's also an anti-inflammatory, which reduces swelling. So it's used particularly for arthritis. Hoffman, the gentleman who ended up isolating the drug and making it acetylsalicylic acid, he used it for his father in order to treat his rheumatoid arthritis. It's also used for muscle strain and sprain, again under the anti-inflammatory category. Now that you know the history, background, and you know a little bit about what the uses are in our bodies, let's go over some side effects. In the 1980s, children under the age of 20 who took aspirin when they had flu or chicken pox came down vomiting, disorientation, coma, brain damage, and sometimes death. This was called Reyes syndrome. The second thing is reduction of a second heart attack possibility. Tests in Britain and America in the late 1980s found that when a person had a heart attack initially, the use of an aspirin regimen ended up reducing the risk of a second heart attack. The FDA approved this in America, but they don't want you to treat yourself, and they don't want you to come up with your own aspirin regimen, so they encourage you to talk to a doctor. There is no evidence, however, that an aspirin regimen can help prevent the first heart attack. It's also an anticoagulant, which prolongs bleeding in our bodies. It can be a good thing and it can be a bad thing. Sometimes clots are desirable. According to Drug Society and Human Behavior, the general rule is no aspirin 7 to 10 days prior to a surgery. When tiny blood clots form in your brain, it's a precursor to a stroke. This is called a transient ischemic attack, a TIA. Because of the anticoagulant category of aspirin, it could prevent recurrent TIAs in your body. Now that you know the history, the background, you know a little bit about what it does to our body and the side effects, maybe we can be a little bit more informed on how we treat aspirin and whether we actually want to put it in our bodies. Thanks.